Now, moving on, Health Cabinet Secretary Cleopa Mailu declared on Tuesday that the government would not open any new negotiations with the nurses on the strike. The CS accused the nurses of orchestrating the suffering of Kenyans through their work boycott. But even as many suffer owing to the withdrawal of labor by the nurses, services at the Dadaab Level 5 hospitals remain uninterrupted. Dr. Mercy Korir is there and joins us live. Dr. Mercy, thank you very much for joining us here on News Center. What can you tell us about Dadaab Medical Hospital? Everything is ongoing as usual, even with the nurses' strike?
Yes, Betty, good morning. And I can confirm that quite clearly the services in this hospital, it's I-42 Level 5 facility, are ongoing. The doctors are at work, the clinical officers are at work, their nurses are at work. And as you can see, currently we are in the postnatal maternity ward. These are the mothers who have just delivered. We have 6 so far. All the beds are occupied. And out of this, there are those that are refugees and those that are from the host community, that is from the local community, whom we are told are actually been seeking services at this hospital. Because even as you are coming here, looking at around the other facilities, they are all closed. And most of the residents around here, for them, this is the facility to seek services from. So they are handling everything from emergency services. Their casualty is actually working and operating. As we came in, there was a patient being seen. The ambulance services are still ongoing. As we were here just now, as we are doing this link, there's a mother who's coming in labor, and it's business as usual at this facility, Betty.
All right, and so what occasioned this? Because, you know, quite a number of hospitals across the country, and you have been covering the unfortunate stories of Kenyans who've not been able to receive medical services. But in this particular hospital, everything, like you mentioned, is ongoing smoothly. So what really has occasioned this? The nurses are at work and everybody is on their workstations?
Well, let me just give a brief history. This I-42 Level 5 facility was opened by the Kenya Red Cross, and the staff that are in this facility and everything that is in this facility is actually operated and manned by the Kenya Red Cross. And I'll just talk to Hassan Rono, who is the health and nutrition manager and the officer in charge of refugee operations here at the Kenya Red Cross Dadaab, to give us just a brief about why they are still at work and what this means to the community here. And Rono, have you been affected by the strike? But as we have seen clearly, operations are still ongoing here. Why is it the case?
Okay, thank you so much, Dr. Mercy and the KTN crew. Welcome to Kenya Red Cross I-42 Level 5 Hospital. Indeed, this is a hospital manned and managed by Kenya Red Cross. In this facility, to reply to your question that were we affected by the strike? Of course, yes, but how? The host communities, all the entire facilities are not operational for the last, I think we are going into our 5th month now. We've just started the 5th month, 4 complete months. So this is an oasis of hope for the host communities as much as we are attending to the refugee community. Here, for the last 4 months, out of the 10 referrals we receive on a daily basis, 5 are actually from the host community, ranging from snake bite at night, obstetric emergencies, mother in labor. The mother from the host community that is here currently had preeclampsia, PET, that is hypertensive disorder in pregnancy, which is actually an obstetric emergency. We have attended to her and she successfully delivered, and she's due to be discharged tomorrow. So, of course, our burden as far as attending to the host community and the hospital operations at large is increased. But for us, we are up to the task. We have adequate capacity. And we have just gone to the drug warehouse. We have adequate drugs. We usually keep for us a buffer stock of 3 months and then 1 month of operation. That's 4-month consignment, which is adequate, can serve the refugee population as far as the host community. Of concern, and something worth noting is the services in this facility are free, whether refugee or host. But maybe sometimes some people may not understand who are these refugees, who are these hosts. The people who came to seek asylum under the mandate of UNHCR and the Kenyan government and are legally registered as refugees, as asylum seekers, those are people classified as refugees. And then who are these host communities? These are Kenyan communities who were living in this area, who are actually hosting these refugee communities for the last almost 26 to 27 years. So these are the people. You've seen we've just passed the Dadaab Sub-District Hospital. It is not operational because of the massive nurses and other cadre strike, the same as other dispensaries. So for us, Kenya Red Cross, even the referral systems is actually compromised. Now we are receiving referrals directly from the community, directly from the villages, instead of passing through the normal referral mechanism, maybe through the sub-district. Now that services are paralyzed even on the other side. Even the referral mechanisms is compromised. So we receive referrals directly. And the services from this hospital, both for refugees and host community, is free of charge.
And you also made to understand that you're receiving referrals from the other facilities in Hagadera, Dagale, and Ifo. Is this the case?
Yes, for us, Kenya Red Cross, as much as every camp, Hagadera, Dagale, and IRC are running facilities which can offer almost inpatient and outpatient services, this is the highly classed facility in terms of infrastructure, in terms of facility, in terms of services, for not only for the refugee community but also for the entire hosting communities. For us, when Kenya Red Cross, when we opened this hospital in July 2013, initially the traditional mechanism of referral for refugees who need tertiary healthcare services, services of a consultant, refugees used to be referred from here to seek consultant services in Nairobi. Then when Kenya Red Cross, when we opened this facility, we thought of a cost-effective mechanism whereby we bring consultants from Nairobi so that many patients benefit, as much as possible. And then we came up with a program of a reverse referral program, whereby we bring consultants from Nairobi. They will be here. In collaboration with UNHCR and other partners, we do a line list, meaning we look at the disease burden for the respective conditions which could require consultant services, meaning surgical cases, obstetric cases, ENT cases, cardiologists which require psychiatric and mental illnesses. We classify, and then depending on the disease burden is when we prioritize bringing consultants, and that has ensured more refugees benefit from the services of consultant services. Like last week, we had an ENT surgeon who was in Dadaab, and all the entire operations from the entire 4 camps were actually happening in the level 5, Kenya Red Cross theater. So from Dagahle, from Hagadera, from Ifo2, all the surgeries are happening, and the same for the surgeon. So this facility not only serves Ifo2 and the host community, but also other camps in the entire Dadaab complex.
So how many patients or clients do you see per day now here in this facility?
Initially, in the normal day-to-day business of looking at, attending to the refugee communities, our emergency sees 60 to 70 patients per day. But now that there is the strike, on the other side, and the facilities are not operational in the government facilities, now on a daily basis, sometimes even the number of consultations can go up to 100, sometimes 80 on a daily basis. But now the facility is more busier, and it is really busy because of the strike on the other side.
Thank you very much for your time. Betty, we are to take another tour around the hospital. And one of the main concerns that has been around since the nurses' strike was on the issue of the immunization and vaccination of children. That since the 5th of June, when the nurses went on strike, children have not been vaccinated. But here in this facility, the immunizations have been going on, and we'll be taking those pictures just to show you that, well, the children from the refugee camps here and from the host community, which is the Kenyans living around these refugee camps, are safer than those who are in other areas who have not actually have had any vaccinations or any immunization going on since the nurses' strike began. Betty.
All right, Dr. Masi, just before I let you go, Dadaab refugee camp is one of the world's biggest refugee camps, hosting about 240,000. Is there really pressure on this particular hospital? Because you can imagine with that number of people, probably there are many people who are seeking medical attention. Is this particular hospital feeling that pressure in any way?
Well, Betty, this particular hospital, Ifo2, is located in the Ifo2 refugee camp. And this refugee camp has about 25,000 refugees. Now, the other 3 camps, that's Hagadera, Dagale, and Ifo, have their own facilities which are manned by different humanitarian agencies, from MSF to Islamic Red Cross. And so those ones are managed, being the biggest facility for the refugees here and those around the community. This is their preferred facility because this is where they get all manner of services, from emergency to specialized to stabilization for those children who are suffering from malnutrition with another disease on top of the malnutrition. This is their preferred choice of facility. And from what we've seen, actually the cases they have here are a bit complex and they require specialized services, and those are being managed from this facility. So this one is a bit different and special from the other facilities, Betty.
All right, Dr. Mercy Korir, they're speaking to us from Dadaab Medical Hospital. Just bringing us up to speed with what's happening there. As you've heard from her, as much as we have the nurses' strike affecting quite a number of Kenyans across the country, everything down there is smooth, and the patients are able to access any sort of medical attention that they need. That is happening in Dadaab. Very interesting story there.